Hey Troy, did you know that Horizon Goodwill is going to rename our Prospect Street building in Hagerstown, also known as HGI2, to the Hagerstown Health Hub?
What? Why are we doing that?
Well, we're going to be including a medical office, and we have Brooke Grossman, our Chief Mission Officer, here today. He's going to tell us all about it.
Good morning, Tammy. Good morning, Troy. Thank you guys for having me on TnT Tuesday. I feel like I have risen to fame by getting to join you this week.
Well, welcome.
So thanks for being interested about what's happening in downtown Hagerstown, too. We have a really exciting opportunity to partner with Meritus Medical Center and our friends at AHAC West to open a primary care office here in our building on North Prospect Street. So what that means is that we will have a location that whether you are an employee or a person off the street, or even maybe somebody who's struggling with homelessness or addiction right now who doesn't have health insurance, that you can come and see a doctor regularly. So we'll have nurse practitioners in our office. We will have a licensed social worker in our office. Our office will also employ what's known as a community health worker. And that's someone to go out and kind of educate the community that there's a medical office here and accessible to you, right? And then one thing our office will have, actually two things that our office will have that most other offices do not. One is a care coordinator. So someone who's essentially your linchpin to making sure everyone who's providing you service or who's involved in your life is aware of what's going on with you. So we can make it as easy as possible for people to get the care that they need, right? And then we're also this is how our partnership with AHAC West comes in. It's so exciting. If you don't have health insurance when you come to our office, that's okay. We're still going to see you. But then we're going to pair you up with someone that's called a healthcare navigator. And their whole job is to help make sure that you get health insurance, whether that's Medicaid or if you have an employer that you just need support understanding their plan. Their whole job is to get you insured. That's pretty cool, right?
Absolutely.
And the other thing I'll add is, that care coordinator's job, if the doctor sends you for blood work, let's say, right? We're not going to be able to do that here, obviously, but the care coordinator will schedule your appointment. And we also have money in this grant that will allow us to schedule you transportation to and back from that appointment if you need it. So that's really exciting. And so this, again, is an office or a medical office for all, right? Not just for someone that doesn't have insurance or just for someone that does, but to service this end of Hagerstown on North Prospect Street and kind of branching out each way that HGI2 covers, right? Same idea as I'm sure you guys have heard about the grocery store we're going to be opening here too, right? Wanting to really be able to impact the overall wellness of our community around us. And Troy, you will also be able to still access all of the services that we've always provided out of this building. Our workforce development programs will still be here. Our Young Adult Solution Center will still be here. Breakfast will still be served a couple of days of the week. And our housing navigators will still be here. So all of a sudden, how many years have all of us heard about wanting to create a one-stop shop, right? So we're looking at wellness from like a whole global perspective and impacting the wellness of the people that we serve here in the city of Hagerstown. Kind of no wrong point of entry, which is so exciting. And the doctor, the nurse, and the social worker and the other staff in the medical office will be part of our human services team and our workforce development team. So if we have shared, patients, as long as they give permission, everybody can be kind of working together as a team to support that person and see about truly lifting folks up. And we'll also be able to take that NP and the social worker out to do some of our street outreach with us too, so that hopefully we can engage people who are struggling right now.
I just love how we still focus on employment, but we have a more rounded outlook about taking care of the whole person, because as you said, it takes every bit of that for someone to even be able to be a good employee. And I just love that we are delving into all of those aspects and being able to help everyone like that.
Oh, thank you guys. And so it's really exciting to see how far our mission has come and evolved over the last 6 years. And it's exciting to be able to pilot this kind of model here in Washington County so that we can hopefully carry it into the other counties that we serve.
But who can access these services?
It's anybody. It's really anyone. So we realize that, we might have some employees that don't have health insurance. right? Or who maybe don't feel like they can take a break, or their doctor's office isn't open when they're off from work or things like that. This office will be for anyone, right? If you're not insured, we'll still see you, and then we'll be able to connect you to insurance. And the great thing for the uninsured population, once they get their insurance, they don't have to change doctors. So that's a little different sometimes. Some free services, you can only see them while you're uninsured, and then you have to go to another provider after. So we're able to provide that continuity of care. And we even, if you guys don't tell anybody, a secret between us right now, we even have a line on some dentists that might be willing to donate some of their time once the office is up and running.
Thank you so much for joining us, Brooke, and for sharing this vision of this community center that we're planning. Stay tuned for an update, and we'll see you next week.
Bye, guys.
Bye.